Did you know that mental health diagnoses aren't based on objective biological tests, like in physical medicine, but instead they rely on subjective checklists? Despite being presented as scientific, these labels are often misleading, reductionist, and even harmful. But is there a better way to understand psychological distress? I'll run through this with you now. Hi, I'm Steve Mayers. I'm a clinical psychologist working in London out of Marylebone Health Group and Freedom Clinical Psychology. And today I'm going to talk about some of the problems and alternatives to mental health diagnosis. Many people assume that mental health disorders, sometimes referred to as psychiatric disorders, like depression, ADHD, bipolar, and psychosis, are the equivalent to medical diagnosis, just like identifying diabetes or a broken bone. But this isn't true. Unlike medical conditions, psychiatric disorders are not discovered through biological markers or lab tests. Instead, they're socially constructed categories that group together clusters of behaviors and emotions. This means that psychiatric diagnoses don't actually tell us anything about the underlying cause of distress. They don't explain why someone feels anxious or depressed. They simply describe the symptoms. And yet, despite this, diagnosis dominates our mental health system, shaping treatment, funding, and even personal identity for some people. The question we need to ask is this really the best way to understand human suffering? There are 5 key issues with psychiatric diagnosis that often go unchallenged. Firstly, it lacks scientific validity. Unlike physical illness, psychiatric conditions are not identified through brain scans, blood tests, or genetic markers. In fact, even leading psychiatrists admit that diagnostic categories are based on committee decisions rather than objective science. It ignores context. Diagnosis takes distress out of its social and personal context. A person struggling with anxiety after experiencing poverty, discrimination, or abuse is given the same label as someone whose difficulties emerge from entirely different circumstances. It can also create stigma and self-fulfilling prophecies. When people are diagnosed, they often start to see themselves through the lens of the disorder, instead of understanding their experience as a part of a broader life story. They may be believed that they're broken or permanently ill. It also drives over medicalization. Once someone is diagnosed, the default response is often medication, despite strong evidence that mental health struggles are deeply influenced by social and psychological factors. This reinforces the idea that mental health is purely a biological issue, rather than something shaped by relationships, environment, and how we make meaning. Finally, it's inconsistent and subjective. Studies show that different clinicians frequently give diagnoses that are different for the same person, which means that it is far from the objective tool it claims to be. So, if diagnosis is flawed, what's the alternative? The answer, as I see it, is psychological formulation. Unlike diagnosis, formulation doesn't reduce people to labels. Instead, it looks at a person's unique history, environment, relationships, and coping mechanisms to build a meaningful understanding of their distress. Formulation asks key questions like, what's happened to you? What are your strengths and coping strategies? How have your past experience shaped your current struggles? Who are the influential people in your life? And what social and systemic factors might be contributing to your distress? This approach acknowledges that distress is often a logical response to difficult life circumstances, rather than evidence of an underlying disorder. It shifts the focus from what's wrong with you to what's happened to you. The consequences of using diagnosis instead of formulation are profound. Diagnosis can lead to labels, stigma, and a sense of being disordered. Formulation enables understanding, empowerment, and solutions tailored to the individual. It also challenges the way we approach mental health treatment. Instead of relying on a one-size-fits-all medical model, formulation encourages holistic, person-centered support. It recognizes that mental health is about relationships, meaning, and environment, not just brain chemistry. So, if you've ever felt that diagnosis doesn't quite capture your experience, or if you've wondered why mental health struggles are treated so differently from physical health issues, you're not alone. The truth is, psychiatric diagnosis is an outdated and flawed system that can sometimes do more harm than good. A more nuanced, compassionate, and effective approach exists, one that focuses on personal meaning rather than arbitrary labels. One that sees people as whole, complex individuals rather than a collection of symptoms, and one that ultimately asks the most important question, not what's your diagnosis, but what's your story.